The project is called the World Mosquito Program, whose mission is to reduce the transmission of mosquito-borne diseases in people. Some of the more common diseases known are dengue fever, Ross River virus, Zika, even yellow fever, and chikungunya.
Social finance has provided outcome-based solutions that support learners in accessing high-quality education.
The WorldScapies program works with government and partners to eliminate scabies as a public health problem worldwide, starting with Fiji and the Solomon Islands. The Scabies program rolled out a mass drug administration across Fiji and the Solomon Islands, protecting more than 1.5 million people from scabies.
The Ocean Cleanup is a non-profit environmental engineering organisation. They've developed multiple technologies to tackle the complex issue of ridding the oceans of plastic. They have developed technologies to not only extract plastic pollution from the oceans, but also to capture it within rivers before it actually reaches the ocean.
Last Mile Health is an organisation that builds healthcare programmes in remote parts of Africa, primarily in Liberia, Malawi and Ethiopia. In short, it's saving lives in some of the most remote communities in the world. Last Mile Health focuses on training, supporting, financing community health workers in remote communities in Africa. The way that Last Mile Health has been able to reach some of these remote communities, having lived in Malawi for 4 years and having experienced firsthand how difficult it is for communities living in rural areas to actually even get the most basic health care, really resonated with me when I learnt about Last Mile Health's mission.
My main role as an ambassador for the World Mosquito Program has been to increase awareness of the program, mainly because trying to sell mosquitoes and the idea that a mosquito program is a cause for people to support is a bit of a difficult sell. So it was quite an interesting challenge to get to do.
So scabie is a very itchy, highly contagious, but treatable skin disease. And it actually impacts about more than 500 million people every year. And in Fiji, it disproportionately impacts children. 1 in 2 children has scabies. And just imagine if your kid have scabies and itch all the time, but you can't treat it, how would you feel? So I just felt there must be something I can do. That's how I get involved.
My role as an ambassador has been supporting social finance in helping them to reach their ambitions. That has been mainly through helping promoting the work of what they do and doing fundraising activities.
As an ambassador for Last Mile Health, I've promoted the organisation across my network, both inside and outside of Macquarie. I've raised funds for Last Mile Health as part of Foundation Week, and I review the financial statements and the 6-monthly reports to help the foundation keep track of progress.
One of the challenges for the World Mosquito Program as they expand is for local governments in countries perhaps quite unfamiliar to us. Can they collaborate with these local governments to actually implement the program? So one of their main missions is getting that awareness out there, and I hope to be able to be an ambassador with that as the years go on.
As a network, we have organised multiple different events to raise awareness and also raise funds for the Ocean Cleanup's mission. We've also this year supported them to progress a global research study which aims to identify global and political incentives to fund the cleanup efforts.
We raised through the Ambassador Network around $10,000, which we used to help one dreamer. A dreamer is a child that arrived to the United States without documentation. I think that education is a fundamental right. It's not just a privilege, and everybody should be able to have access to a good education. You think about the shortage of skills that there are some sectors and industry have. Social finance play a key role in society.
I'm proud to be involved with WorldScapies program.
I'm proud to be involved with social finance because they are advancing a lot in improving lives of peoples and communities.